Welcome, everyone. Welcome, welcome. I'm excited you're here. Thanks for joining this session on pet inclusive detox beds. And my name is Vickie Ramirez, and I'm the center manager for the Center for One Health Research at the University of Washington and the co-director of the One Health Clinic. And as someone that implements clinics and does the evaluations on the health benefits of the human-animal bond, I'm so excited today to be able to moderate this session. If you were in the past session just a second ago, you heard about and saw images about how cool Father Joe's Villages is and how successful their campus-wide co-sheltering is and how ridiculously cute Snickle, Fritz, and Chauncey are, and their relationship are. And in this session, you'll hear about their absolutely unique and novel model of co-sheltering during detox treatment and recovery. So just really quick, I'm going to fly through these so that they can tell you all about their program. I'm going to do some introductions. We have Mary Jo Scarpitti. She has worked in the healthcare field since 2006. She began her career as a certified nursing assistant, later becoming a licensed vocational nurse and then a registered nurse. And she joined Father Joe's Village's Village Health Center in 2018 as a referrals specialist, subsequently transitioning into a registered nurse role and later advancing to manager of clinical services. After she earned her Master's of Science in Nursing with a focus in leadership and administration and obtaining certification as a substance use disorder counselor, Mary Jo was promoted to clinic director in 2023. And in this role, she provides administration leadership for the health center and oversees both the street health and the detox programs. And then we have Megan Partch, who has worked in the field of mental health and substance use disorder treatment for nearly 20 years. She earned her bachelor's degree in psychology from San Diego State University, her master's in clinical mental health counseling from the University of San Diego, and her PhD in counselor education and supervision at Oregon State University. Dr. Partch joined Father Joe's Villages in 2015 as the Behavioral Health Program Manager, providing oversight for Father Joe's Villages mental health and substance use disorder treatment programs. And in 2018, she joined the Village Health Center, the on-site federally qualified health center and healthcare for the homeless clinic as the clinic director. And in 2023, she accepted the role of chief health officer. Dr. Partch is a part-time faculty member at San Diego City College in the alcohol and other drug studies department, where she teaches intro to substance use disorder counseling. And outside of work, she enjoys times with her daughters, spoiling her pets, baking, and spending time outdoors in the San Diego sun. So please, everyone, welcome this amazing talk. I'm super excited.
Well, thank you for queuing us up, Vickie. We are equally excited to be here with you all, and so pleased to be sharing about Father Joe's Village's services and programs, which are near and dear to our heart, and especially focusing on our detox program that's newly opened, and hopefully encouraging you to consider the ways that you might be able to modify and structure programming to support your community's most vulnerable, who are also accompanied by pets. So without any further ado, we are going to chat through our agenda here and we'll kind of get things underway. We've done some great introductions, but Mary Jo and I will also share just a little bit about us personally and what kinds of brings us into this specific space of work. We're going to be talking very broadly about the state of homelessness. We'll give you a quick overview of Father Joe's Villages as a very large social service, homeless services provider, and talk about the Village Health Center. We are going to share about some of the more common barriers to services and care that we see here for our community members in need, which really kind of tells the flow and the story of why is this so important, what we're discussing here today. Why are recovery services that are pet inclusive so critical within our communities? So we'll talk about our detox program. We'll share some of the preliminary program outcomes to date. We'll have some time for Q&A. And so we encourage you to be sharing those through the app. And Vickie is going to help kind of moderate some of that for us. And then at the very tail end, we have some actionable steps that you might consider employing within your specific organization to be able to bring about programmatic changes. And of course, the one that we're advocating for most is expanding those services that you provide to be more inclusive for people and their animals and the animals who love them. So I'll kick it over to MJ first to share a bit about kind of herself and what brings her to this presentation.
Hi everyone. Super excited to be here and grateful to be able to present on um, this amazing opportunity that we have at our detox program to allow our clients to co-shelter with their pets. I recently this year became a pet owner. I've always liked animals, but didn't necessarily want to do the whole caretaking of them. But the world had other plans. The two cats on the left, Nezuko and Yoshi, came into my life when they had, sorry. Uh, they were in a environment where they could no longer be cared for. Their caretaker was struggling with substance use issues and needed to go to the hospital. Um, sorry. Um, and so they were going to go to the Humane Society and likely to be separated. So I said, I can foster them till she gets out. But it ended up being that we fell in love and they're my babies. And I never thought I'd be a crazy cat lady, but here we are. And we'll be welcoming, I don't want to spoil it, but I will be welcoming another kitten on Friday.
So a growing family. Yeah, when Mary Jo said, "Do you think I should get another kitten?" and showed me the picture, I think I responded yes with lots of S's and lots of exclamation points. There was no hesitation. I'm certain we're among friends here, and you agree. So, what brings me to this work is certainly a passion for getting people access to behavioral health services that they need that I know can be life changing and life saving. And what kind of grounds me in the pet inclusive component is my heart and soul, Bailey, who's pictured here. She's the pit bull. For those of us who have ever loved or been loved by a pit bull, you understand that they are such a misunderstood breed. And there's a lot of stigma around them, much like we see in the way that our communities treat individuals with substance use disorders, very misunderstood and sadly very stigmatized. And I learned in my own experiences, of which, I had the luxury of a lot of support and luckily a lot of resources. But I learned through my own experiences just how difficult it was to find places to live in the community that would allow me to cohabitate with a pit bull. And oftentimes I would call apartments and say, "Hey, I see you have an opening." And they'd say, "Yes, we do." And I'd say, "Do you have, do you allow pets?" "Yes, we do." And I said, "Do you have any breed restrictions?" And they say, "Yes, we do." And in one case, somebody said, "Well, couldn't you find somebody else to care for your pet?" Of course, I had some choice words floating around my mind that I didn't share with them. I said, "I don't think that's the direction I'm headed." But those are some of the decisions that many of our community members are forced to make very frequently, is I want care? Do I want shelter? Do I need these basic resources or even treatment more than I love my pet? And that's a very unsettling space to be in, to have to make decisions like that. And so the idea that we could create a space where people could care for themselves as well as be loved by their pet, which is often their confidant, the only sense of warmth, touch, love, companionship, feeling seen and valued that they've had for a significant amount of time, not breaking that bond is really, really important to us. And so Mary Jo and myself have nothing but empathy for the folks who are in our program, not only in their experience of substance use disorder and the recovery that we know is possible for them, but also what it's like to be a dedicated pet owner, or, if you have pets, they own us, not us, them. So sharing a bit about, zooming out to the state of homelessness, we know that sadly, that more and more individuals on the national level, on the state, and at the local level are experiencing homelessness year over year. The data here displayed is from 2024, since that is the most recently published national data available to us. In California, the experience of homelessness is especially devastating through a number of our communities, but San Diego and Los Angeles and San Francisco have some of the most startling numbers. And sadly, in San Diego, our numbers are nearing the 10,000 individual point, and a very significant percentage of those individuals experiencing homelessness in San Diego are unsheltered in their homelessness. So they are residing in streets, parks, canyons, other areas that are not meant for human habitation, living out of their vehicles, couch surfing, all of these other things that we know are not sustainable nor safe. So enter Father Joe's Villages. We have been around as an organization for 75 years. And the mission that we have is to prevent and end homelessness one life at a time. When you look at the number of individuals experiencing homelessness in our community, it can be very overwhelming to consider this goal. But when we break it down by one unique life touched at a time, it is really meaningful and fulfilling work that we're doing. And we believe that the Detox is a space that is really kind of a wayfinding point for people. There is on a daily basis the chance that people get to make the choice to do something different, which we're so proud of. And that is seen throughout our variety of services and programs on our campus. Father Joe Carroll, who's pictured here, came to the helm of the organization in the 1980s, and he said, we really need to have this one-stop shop model. We need people to be able to go to one place, and we want to break down barriers that they have to care and services so that they can accomplish all of the things that they need in one environment, instead of having to worry about how to get from one place to another. The wait list for shelter is here. My next meal is there. If I want healthcare services, it's over there. He said, why don't we bring all of these things together in this campus model? And so that is what we have in downtown San Diego. We have a campus across many city blocks, and that is comprised of a number of different services that really allow people to leverage their own unique strengths and resources and supports and skills and goals to establish partnerships with our team in a variety of different areas that are most relevant to their needs so that they can stabilize and transition out of homelessness. And so that really honors and values our community members as the people who know best and are most expert of what their needs are, instead of giving them a one-size-fits-all approach or a one-size-fits-most approach, which is very costly. We're providing them an array of services that they can opt into that would allow them to advance in the ways that they see fit at a time that they are ready. We do all of this work grounded in the spirit of our creed, and that stands for compassion, respect, empathy, empowerment, and dignity. And so the way that we join with one another as colleagues, the way that we support our community members, the way that we work with our community partners to better the futures of our clients and patients is through Father Joe's Villages creed. So as I'd referenced, on our campus, we have a variety of different supportive services to assist individuals. That's anything from short-term shelter services to longer-term affordable housing and permanent supportive housing. We have a public lunch line. We have a food bank. We have our on-site federally qualified health center that we'll share a bit more about, and some of the other health services that are available on our campus to help people to rehabilitate and stabilize and transition out of homelessness. We have a state licensed therapeutic childcare setting, acknowledging that sadly, many children who experience housing instability in their younger, more formative years are likely to continue to experience homelessness later on into their adult years. And so really stopping that cycle. We have vocational services on our campus, chaplaincy services, other health and wellness services, really focusing on building resiliency, hope, and joy for a brighter future. So on our campus, one of the many supportive services that community members can opt into is the healthcare services that are provided at our federally qualified health center. So we have some of your basic kind of healthcare services. And what I mean by that is we have primary care, we have psychiatry, dental, and behavioral health services, including individual and group counseling. We have nurse triage that allows individuals who would like to walk in and request a same-day service with being graded by a nurse who does clinical assessment and then looks for spaces on our schedule where individuals have canceled, missed, or rescheduled their appointments. And we leverage what would have otherwise been an underutilized appointment time for that person who's walking in. So far this year, on a daily basis, each day that we're open, we have over 50 community members who walk in daily asking for services and asking for same day help. And that can be from someone who needs a tooth extraction, which is causing them a lot of pain. Or it could be somebody who walks in and says, I heard you have a detox and I'm sick and tired of being sick and tired. Can you help? And so that nurse triage team really does the puzzle of kind of figuring out what that individual's unique needs are and looking for a way that we can support those needs as best we can. We also acknowledge that for our community members, if we were to support them in the same way that many of us receive services, which is empowering the patient to go to the pharmacy, to go to the lab, to navigate systems and processes and transportation and all of the things themselves, some of these care services won't happen. And so we really try and embrace them when they are on our campus and provide them with the holistic care needed. Sometimes that means that they're getting primary care and dental on the same day. Oftentimes that means that we're trying to run same day labs while they're on our campus so that we can be informed of what their health needs are and how things are going for them. Really trying to address things while they're here, not only to honor the fact that they made it despite so many challenges, but also to be able to provide them with the most comprehensive care possible, acknowledging that they may not make it back tomorrow or the next day or the next day. We don't do everything in-house, so when needed, we refer out to specialty care services. We support insurance enrollment for those folks who need access to benefits or need help with navigating their benefits, because none of us, even those of us who work in the field, none of us speak health insurance. And as referenced, not only do we do scheduled and telehealth appointments to meet community need, but we also have that same day walk-in access as well. That is for the people who can make it to brick and mortar, of which we realize many cannot. And so we formed a straight health program. And so we have 3 vehicles and teams of outreach workers and clinicians that partner in the community and deploy every care service that we have, with the exception of dental, which still requires a chair and air and water and all these other things. So dental services are in-house, but everything else that you see listed here, including psychiatry, behavioral health services, and so forth, is rendered for community members who are experiencing homelessness that otherwise have such significant barriers that they can't come into our care services. We do all of these through evidence-based modalities, acknowledging that we need people to have the most high-quality comprehensive care possible. And last year, our small but mighty clinic served nearly 4,000 people through a number of, as we'd referenced, encounters. So primary care, behavioral health, and so forth. And so you can see of our different kinds of lines of business, so to speak, these different service areas, just the number and frequency with which we are providing care. So there are a lot of things that keep our underserved and under-resourced community members from connecting with service providers, healthcare providers included. Some of that is a lack of knowledge of what's out there, how to get to it, where it is, what the hours are, and so forth. We take the ability to search Google, the ability to either navigate public transportation or hop in our own vehicles for granted. It is very difficult for our community members who have lesser resources than we do. Belongings, in general, for individuals who are unhoused, they may have every single thing that they own that goes with them everywhere that they go. And so that burden, as well as where do I take this when I'm connecting with a care provider? And that might also include things that are keeping them alive, including things like substances and weapons. And so how do they account for those items, or where do those things go? Is there somebody that they can trust these resources with? Trauma, shame, stigma, distrust, historical distrust of providers, vicarious trauma, all of these different things keep people from wanting to establish therapeutic and care relationships. Disabling conditions, including behavioral health diagnoses, lack of childcare, and then also how to navigate all of these systems and processes with pets that may or may not be accepted in specific services. So lots of different barriers and more, but these are some of the ones that we have really contended with the most, and then really challenged ourselves and our clinicians to think of creative means to help people to navigate. So this is pertinent because we've shared that sadly, homelessness in our communities is on the rise. The number of individuals who experience unsheltered homelessness is again on the rise because our resources in our communities are stretched thin and already not enough to cover the needs of the folks who are really trying to survive. And sadly, health outcomes are really horrible. Individuals who are unhoused will die sooner than their housed peers. They have very significantly poor health outcomes. They have higher chronic disease burden. They're more likely to be the victim of assault. The experience of trauma is very high. And then that leads to the potential to have longer term, very chronic experience of mental health and substance use disorder, whether that was a precursor to homelessness or response to homelessness. And in many circumstances, we're learning that people are using substances in our community to stay awake and hypervigilant to care for themselves, their children, their belongings, their pets during the night hours. And so whatever it might be, whether the substance use disorder was pre-existing, precursor, an antecedent, or otherwise, a consequence of homelessness, it needs to be addressed. And we have seen in our community some very sad outcomes and fatalities that could have potentially otherwise been avoided if there was more ready and timely and expansive access to care. So this is where Father Joe's Villages, of course, steps in.
So how it started, we have been really taking a harm reduction and low barrier approach to services. We were a low barrier shelter. So in the building with the health center, we had a women and men's shelter. Low barrier, you could be under the influence, you could use substances, just not on our campus. Based on kind of the need that we've seen within the community and our clients, patients that we've served at the health center, we knew that we needed a different approach to fill in that gap. Our clients needed a safer environment to recuperate from substance use. And so we transitioned into a sober environment within the Paul Marable Center, which is the building that our health center resides in. So we still take a harm reduction approach to services. We meet people where they're at. We build those relationships. And so also we leverage existing resources. So it started by us kind of seeing what we already had that was working and how we could kind of build scaffolding from that. And so we did a phased approach. We, over time, we added a little more as we gained more resources and more knowledge. So we leveraged the resources and partnerships that we had. We purchased crates, pet supplies, and food. So really leaning on partner organizations like the Helen Woodward Animal Center, the Humane Society, generous donors, and some that we were able to purchase through grants. We also have our Father Joe's Villages mini grants that our staff are able to apply for funding to support different initiatives. And so some of that was used to support pet projects. So what does this look like in practice? So this has evolved into co-sheltering. So our shelter systems were already doing it, luckily for us. So in building that into the detox program, we had a lot of people that could give us pro tips on how that is rolled out, what you'll need, what policies, procedures, etc. And so we leaned on them. We provided pet relief areas, pet wash stations, and then at the day center, we participate in pet events where we have Helen Woodward, Project Street Vet, and different organizations that come and support pets. So our detox program, we opened in September. We are a 44 bed and 11 rooms at detox program. It is co-ed. This stay is about 4 to 14 days. And co-sheltering, as was mentioned, we're fully integrated with our health center. So all of those great services that Megan shared about just a moment ago, we are able to connect our detox clients with. And then post-treatment, we're working on their transition planning, either it be a residential program, a RISE, our sober shelter, our recuperative care program, or sober living, and wherever they choose to go as their next stage. So RISE, Reaching Independence and Self-Empowerment, is a sober shelter. It is 248 beds, co-ed. Clients can stay there for up to 1 year, and they are able to co-shelter with their animals. But clients must agree to be abstinent. They must agree to intensive case management, creation of a budget, savings plan, random drug testing, and again, remaining abstinent while in the program. So that this was a big change from us being a low barrier program to now having this requirement. But it has been a godsend for us within the detox program to be able to transition clients from detox that have a pet. There's no residential programs, or maybe few, none that come to mind, where we can transition clients with their pet. So we look into foster or other alternatives, but Rise has been great for us to be able to to discharge our clients up to that shelter, be connected to the health center, and have the supportive services that are offered there. So our program outcomes to date, oh, and this photo right here is our pet washing station. So you can see our residents and clients are able to give their pet a nice shower in that area. And so just to give you guys a bird's eye view of the substances that we're seeing clients impacted by, the most appears to be meth, and alcohol and opiates are our main kind of things that we're contending with. Also benzos and marijuana, less so there. So since our program is opened, we've served total participants of 281. Out of those, we've served 23 pets as well. So participants accompanied by their pets, 25 dogs and 2 cats. And so the largest number of pets served at one time has been 3. So we've been able to navigate kind of 23 clients and 3 pets at this time being the max. Here's some of our outcomes to date specifically related to those with pets. So of those 23 clients that came with their pets, we have 10 that successful completions, mean that they finished the detox program and we connected them to the next level of care. So that is about a 40% completion rate. And compared to our average daily census, which is about, 16, and average bedfill rate is about 36.4%. So we just opened in September, as I mentioned, and so we're slowly kind of ramping up. So looking to serve more individuals and getting the word out there, really, that we are pet friendly. You know, a lot of people don't even attempt to go to treatment knowing that they won't leave their pet behind. So trying to get the word out there. So hopefully you all can share of this offering as well. So average length of stay for those that are pet owners has been about 6.5 days. And compared to the general population, which average length of stay is 7.9 days. Readmissions, so we've had 3 pet owners that were readmitted into the detox program. This is a good thing. This means that these people, you know, fell into hard times again and felt comfortable to come back. So they knew that they and their pet would be well cared for and were able to return to the program. Overall, we've had 31 readmissions of detox entirety and 3 pet owners. So the average length of stay, successful completions among pet owners has been around 10.8 days. And then the average population of successful completions overall is 11.5 days. All right, so you can see the percentage, 40% for our pet owners and 52.2 for overall all detox departures. Definitely a smaller pool that we're running these numbers for our pet owners compared to the denominator for the others.
Yeah, and we will say there, you know, correlation, causation, that will be something that research partners will tell us. And of course, we have not yet hit our stride nor baseline, but this is just preliminary information that we can share with you at this point in time. So excited to be able to share these metrics.
All right, so lessons learned. So client impact is huge, access to treatment, and then the next steps. So I've had so many instances kind of in help as a nurse or as a substance use counselor trying to connect clients to services and then being like, well, I can't leave my pet. I'm not going to, that's my family, you know, so they uh, put their own health at risk because they can't leave their family member. So being able to now say, well, that's okay. I have a program you can go to. I know of one, you know. In fact, I know the people you do the referral, you let me know. It has been huge. So it takes away a huge barrier that people face. And what we've also had to do is educate people that are being referred in about the intensive modality. So it is a different environment. You are going to need to participate in groups. You are going to need to, it's a structured environment. So are you ready? Are you ready as an individual to make that step? And then also, is your pet ready? So we've seen some pets have some anxiety in the environment. So you're bringing them into a population with up to 44 people and sometimes other pets as well. So is your pet ready to kind of deal with that? Go to the restroom on a certain schedule, have meals in a different environment. So although it's great to be able to keep your pet connected to you, is that the best thing for your pet? And if it's not, then we have been trying to build and leverage partnerships, which I think might be the next part to foster animals. So getting those connected to, I believe the Humane Society has up to 90 days foster available. So we've been really trying to learn more about what's offered for pets in the community. And so kind of growing that from here.
I will say too that I spoke with a detox participant on Friday of last week, and we were chatting about his little dog who was with him, and he was, proud papa. He was saying, "I'm just so proud of her. I wasn't certain how she'd do here in a closed environment with a lot of people that she doesn't know, and I didn't know if it would be too loud, and all of these things." You could tell that he, really caretakes for her, really cares deeply about her experience, and if she feels safe and all of these things. And so it was so sweet that he was just doting, and I'm just so proud of her. She's done so well here. And I'm certain that, the same could be said about him. Like I'm certain she's proud of him being there and doing the hard work that he's doing so that they can both have better futures. But it was very sweet how, as I was engaging him, he was just remarking about how proud he was of the way that she had adjusted to the detox environment. And I was very pleased to come in at the start of this week to learn that he has transitioned to a next level of care, that he's continuing in his recovery journey. He completed the program successfully. And of course, is paving the way to a brighter tomorrow for him and his tiny companion. So it was neat to have that interaction. And of course, to hear on the other end of that he had a successful outcome. As Mary Jo was referencing too, I have no doubt that if something was to happen for this individual in the future, that he has felt very cared for and supported, as well as his pet feeling cared for and supported, and that he wouldn't hesitate to reinitiate care with us in the future based upon their experience. And that is such a gift to know that people will come back to us.
So community impact, so the engagement with peers and animals. Animals are therapeutic. So welcoming some pets into that environment has made a big impact. When we were kind of dreaming this up and we're saying we're going to have a co-ed detox program, I'm like, co-ed, and then we're going to also have pets. I'm like, oh, how are we going to manage all of this? And it has really went super well. It has been easier than I always want to knock on wood as I'm saying this, but it has been great. The pets have been a great addition. It really helps the owner, it helps the other peers that are interacting with the pet as well. There has been some staff impact, so some staff members love it. Some have felt a little more stressed as our clients are at their worst. They are struggling to care for themselves. So we're also asking them to be independent with caring for their animal, although staff supports them. They need to be independently care for themselves and their animal. So there's been challenges there with making sure that they're cleaning up after their pet and oh, I don't feel good. I don't want to take the dog down to use the restroom. Well, you have to, So there's been some empowerment that's needed to happen, but overall, it's been, I think, a great impact on staff and clients alike. So some challenges, I already kind of spoke to that. We had, only one really comes to mind. We had one individual that, just was having challenges cleaning up after his pet, and we had to kind of lean on our facilities department and our staff and where to purchase supplies to put it where it's easy for him to reach it and make sure we have the doggy bags and all the things accessible. But more than challenges, we've had a lot of success stories. So 23 individuals were able to get treatment that otherwise may not have because they were able to bring their pets. We had a gentleman that started with us. I think he may have been one of the first few clients that we had, and he brought his dog in, and he just said how she was his life, and she saved his life, and he hadn't had her long, but she gives him purpose and she gives him the desire to get clean and provide a better life for her. And he was so grateful that he had a program to where he could bring her. He had been struggling, he said, for about a year after a relapse, and just refused to get treatment without her. So with that, he successfully completed the detox program. He was able to go up to Rise, our sober shelter, after that, where him and a baby girl have been thriving. He did say there's a lot more action up there. It's a little stressful for her, but she's doing great. He was able to go into our culinary arts program, so he is receiving kind of coaching and guidance and career readiness through them. And I just received word that he is planning to go into sober living this week. So a huge success that was possible because he could navigate the beginning stages with his animal alongside him.
Yeah. I mean, it warms my heart that that was a potential for him, given this program. And we always, speak with our team about any person who comes in for any amount of time is someone who is given the opportunity to choose differently, which, as Mary Jo was referencing, might not have been something that they would have had access to otherwise. And that's for the individuals who are accompanied by pets, as well as those who are not. Access to treatment is so critical, but especially for these individuals that would otherwise have elected to not care for themselves, to be able to be a partner to their pet. We're just so pleased to be able to provide a service that allows every piece of them to be here and to be supported. So we welcome questions. I believe that some folks have maybe shared some, and so we'll send it to you, Vickie, to let us know what we can share about further.
Yeah, thank you so much for your presentation. It's amazing to hear all the work you're doing, especially as someone who has failed community members in the past who had been ready to enter detox. Beds were ready for them, but I couldn't find them a foster. And so that moment's gone, and we have to wait till the next time. So just having that available to someone is just makes me overwhelmed. Um, so we do have some questions in the chat, and I've been looking at them, and I'm going to for this first questions, I'm going to kind of combine two. Um, so what are for an organization that wants to start with co-sheltering, but they want to start small and they don't want to overwhelm their current resources, what would you suggest as a good place to start?
Starting is a good starting point. So I think we very similarly, as an organization, when we first embarked in co-sheltering, there was a lot of apprehension from our entire team about what is this going to look like. And I can say we were making numerous programmatic changes at the same time with harm reduction at kind of the forefront of our mind. And so when we're saying harm reduction in terms of acknowledging that you may still use substances, but please don't use those substances or bring paraphernalia on our campus. That was one thing that we were contending with. And then the mindset goes, oh my gosh, now what if everyone's using substances? And it was the same thing when it came to co-sheltering, when we said we're going to permit people to be accompanied by pets. I think the mindset goes to what is the furthest extent that this could be? Oh my gosh, we're going to be at a 1-to-3 ratio, 1 human, 3 pets each. It's going to be a dog, a cat, and a rooster. And so I think people kind of conceptualize that it is going to go so far out so fast. And I think when we had conceptualized the detox, there was some of that same maybe fear of the unknown. And when we state that we're a pet inclusive detox, and we know that nobody else is doing that in our community, are we opening ourselves up to, folks coming in with 5 pets per? And it's really not that that's been the case. As we'd referenced, we've served 281 unique individuals. Of those, 23 were accompanied by pets. There's really not ever been a time in our milieu that we've had more than 3 animals. What we have learned, of course, is to have dialogue with the individual at that screening point of saying, do you have a pet or pets? What kind? What are their needs? What are your needs? How can you find a balance of caring for yourself as well as your animal or animals? Is this the best time to do both? And how can we do that for you in a supportive and safe manner? And so I think a lot of it has just kind of opened our eyes to, first, it's not as big as it seems. When you open up the possibility for folks to come in with pets, it doesn't mean that every single person will come in with a pet. It's usually the same flow of community members that you've been seeing, and maybe a trickling of individuals who have pets as well. And again, our assumption was that our detox could be more impacted because there just is no other model for it. And so many of our unhoused community members in San Diego are accompanied by animals. And yet it's not that it's just been this, huge mass of folks coming in all at once. So what we've taken from our experiences, usually what you think of as what's the furthest it could go or what's the worst case scenario is the least likely to happen. It's not been that's how it's rolled out for us. But as Mary Jo had referenced, we also had the experiences and learning that we could draw from our partners at Father Joe's Villages and our shelter services, who had kind of charted a path ahead of us and were able to share with us some of their policies, some of their procedures, some of their educational methods. So we were able to leverage that. And if you don't have those same resources within your organization, we would be honored to support you in that. So if you'd like to have further discussions with us about, how did you do this, or what kind of documentation do you have for that, or if this was to happen, what might you do? We're obviously happy to provide that technical assistance or consultation as needed to help to alleviate some of the concerns that you might have. Again, the concerns, it's not to say that they're unfounded. It is to say that we've found in our experience that it just isn't as impactful in a negative sense as much as it really lends to the environment. Our team is happy, our clients are happy, we're building connectedness, we're serving people more fully. And as you see that kind of unfold, it is very fulfilling to be a part of and to witness. Mary Jo, I don't know if there's parts of that response that you want to jump off of, or anything that I've missed.
No, I think you summed it up really well. Just make the decision to do it, and then have kind of clear policies and procedures that are saying, and maybe an admission agreement, you are responsible for the care of your pet, and having kind of all of it outlined as what the expectations and rules are related to that. And it has been so much easier than I ever dreamed it could have been. And also the volume is so much less, like Megan was saying, you go like, oh, we're gonna open the floodgates and everyone's gonna have a pet or two. And it's, at max we've had three. So yeah, do it.
Yeah. Chances
Oh,
are the assets you need are the ones that you have. You already have a dedicated, hardworking team. You maybe already have a shelter environment or a care environment or a social service environment that's serving people. So really the foundational elements are those. And that's, as Mary Jo had referenced, those are the things we leverage is we've got the space, we have a community who wants to be served, we have a team that wants to serve the community more fully. And when those things are in alignment, it tends to kind of fall into place, and you're able to then approach it with curiosity and also with the willingness to kind of course correct and continue to improve over time. Thanks for the question.
excellent. That's a great question. And I maybe I would add, and tell me if you agree, that if you are interested in exploring co-sheltering in a detox setting, you can put a cap on how many, like right when you start, you can say, we're going to start with allowing two animals and then see how that goes. And then modify as needed. You don't have to go all, I mean, Father Joe's Villages has the benefit of having that foundation to build off of. But if you're new or if you're a smaller organization, baby steps, but being
Mhm.
open to trying, I think, is a huge, yeah, can't
Yeah.
hurt. And or if it fails, and then
Yeah.
you're like, okay,
Yeah, it's a
transition
short-term
again.
modality, right?
Yeah,
And sadly, many of these modalities do have wait lists, and so it is not unfounded to say, hey, there might be a few days before a bed is available, or there might be a few days before one of our rooms or spaces that lends itself to, providing you and your pet with the support that you need. And so, yeah, it's a great point, Vickie, that you don't have to like dive into the deep end. You can also create parameters for your programming that you feel most comfortable with. And probably then when you say, two pets and then that third person calls and they've got a pet, you might be like, I feel like we can make it happen for them. If you have the resources available. So it is a great point though that you don't have to say it's a one for one or whatever it might be. You can create the constraints by which you feel you can provide the safest, most high quality programming.
great. Okay, so the next question, you covered some of the expected barriers that people may think of. But this question says, what are some common barriers programs face when trying to offer pet inclusive detox services? Um, then they say, especially for smaller organizations, and maybe I would add, are there did you hit some barriers that made you change your protocols since you kicked in September?
Yeah, so I think one of the things that we've learned from our team that we just hadn't really thought about is, again, we were thinking so much about the holistic needs of the patient or participant. We were not thinking as much about the needs and experience of pets, and yet these things are intertwined. And so one of the things that we had heard right off the bat was, many of these animals are used to living in environments that can be very uncomfortable. They're used to alleviating themselves in areas that, are by necessity. Like, I need to go to the bathroom. I'm going to go to the bathroom here. It's not that their human is taking them for a walk to the park, to a grassy area. It's like they are relieving themselves in the space where they need to relieve themselves. And so at least one pet was kind of like, well, that corner over there looks good, or the flooring over here looks, agreeable. And so those are some of the things where we kind of right off the bat, we're like, oh, we hadn't considered that. And so as Mary Jo had referenced, it was okay, we need to have cleaning materials on hand and nearby. And then we need to empower and coach our participants from the mindset of as you continue to stabilize and move to greater autonomy and those next steps, you are going to have your own apartment. And this is something that you'll have to contend with there as well. And to be a good roommate or to be a good tenant or whatever it might be, caring for your pet and making sure that if they do relieve themselves indoors, that you're addressing it really quickly is something that you'll be charged with doing. And so we really had to start kind of thinking not just of the really great patient or participant experience that we could create, but also what is a way that we could create the experience for their pet to be safer, cleaner, all of these things as well. And was that resources that we needed or otherwise? So that was, I think, a significant area of learning for us from the get-go. What else were you thinking, Mary Jo?
I was thinking a huge barrier we're facing is where to transition clients to next. There's really no residential program, or I shouldn't say no, but there aren't many residential programs where we can discharge clients to. So we've really relied on RISE or recuperative care. And recuperative care is only up to 90 days and certain elements that require clients to that they're required to be accepted into that through their health plan. So really limited services on transitional care because we're stabilizing them for 10 to 14 days and we know that's not enough time. That's enough time for their head to kind of get clear enough to make the next best decision. And so we really haven't had to discharge someone to the street yet because we've had the luxury of RISE, but as those beds fill and as our capacity grows, that's going to be a real reality. So that's a huge barrier right now.
Yeah, so creating additional partnerships with other recovery entities or sober livings and so forth that permit people to be accompanied by pets. To your point, we're really leveraging the partnerships on our campus within Father Joe's Villages, be it the sober shelter RISE program or our on-site recuperative care program to give people that additional stabilizing time. And so being mindful of the throughput. So for each of the folks who are joining us today, if you might be that one stabilizing force for a short period of time, is there a next step? Or how can you help people to piece together some next steps that don't put them back where they started? And that's challenging.
All right. I'm going to ask a question that's a little bit off the question thread, but I think
Ooh.
it'd be helpful. Um, Say you were not at Father Joe's Villages. You have a new job and you're in a new location.
And I
Mary
want to go
Jo,
back to Father Joe's Villages. Okay. Uh-huh. All
yeah,
right.
exactly.
Okay.
Mary Jo, you're in a small type of shelter, and then Dr. Partch, you're in a county level facility, kind of big level, lots of layers. You want to start this program. Who is the first person that you would contact to start trying to build something?
I don't know, Mary Jo, are you recruiting me to come join you at your organization or
No, just two different. I'm trying to think of like two different
I'm
settings where like
teasing.
there's a lot of theoretical resources and
Yeah.
maybe lesser resources.
Yeah, it's a great question. So on our next slide, we actually have some kind of steps that we have proposed. It was the pathway by which we have been most successful with navigating a lot of the programmatic changes that we've made, of which there are many. And ours really started with our board and key leadership. And I think in many settings that really is where a lot of things start is if you don't have buy-in from key leadership, if you don't have, for the folks who oversee finances, for the people who are going to ask hard questions, for the board that, has oversight and governance. And those are really kinds of the spaces that you need to start. And a lot of it is by articulating the rationale and the need and really speaking to what your entity's mission and vision are and how you can further support your mission and vision as an organization by creating space for inclusion of pets. And so that's kind of skipping ahead, but I would say, cheating, knowing what's upcoming in the slide deck, I think it really starts with having a sound rationale that is stated at the highest levels where you really need that support and buy-in that will help you to gain momentum. In the absence of senior leadership being on board, in the absence of your governing board's oversight and support, then you might really struggle. This would be pushing quite the boulder up the mountain, especially in larger systems. And so in a smaller entity, Mary Jo, where might you start?
I think networking is huge, tapping into, you call the Humane Society, call whatever organizations are doing it. Be that squeaky wheel, be that inquisitive person that's not afraid to go out there and shake hands and, hey, how are you doing what you're doing? We really kind of started a lot scrappier than we are now. So like with the kind of beginning of our street health program, it was an outreach worker and a clinician with a backpack just going out into the community. So I think just not being afraid to put yourself out there and then ask other or get to know other organizations, how they're doing it, what resources do they know of? Because there's a lot of resources out there. I think a lot of us just don't know how to access them. Um,
Great. I just saw our thing. I want to talk about data for a little bit. So if you don't mind, I'm gonna jump in with a couple of the data questions because we have 5 minutes left in the session. Um, I am scrolling. What is the N? So I'm going to read you the straight. What is the N for the metrics you shared? The preliminary outcomes are really interesting and mirror the findings from the California Pass Program analysis. People with pets who get access to service exit programs successfully at higher rates.
So we're not necessarily seeing that individuals who are accompanied by pets are completing the program at a greater rate than their peers, than the general population, but we are seeing that they are showing up and that they are accessing services and that they are likely to complete. We're also seeing that they are likely to readmit to services should they need them. So I think that the preliminary outcomes, though, again, we don't have a baseline. I think that they point to programmatic success. I think they also point to the fact that we want to look at more than just the numbers, but also start to be really curious, asking the individuals who participate in our services about, what was this experience like for you? What did you run into that worked? What didn't? And that's globally. We want to ask all of our clients, and we're going to be deploying a satisfaction survey for the folks in short order. But there may be some additional questions that we'd like to fine tune that really focus on the experience of those folks with pets. And so we never leave our programs as is. As Mary Jo referenced, Street Health started with granola bars and a backpack. And now it's 3 vehicles and a large team. And so I expect that Detox will be very much the same way, that we are going to continue to evolve and improve the program based upon the stated needs of the individuals that we serve. And if the service isn't serving those folks well or fully, then shame on us. We need to do better, and we will. But we only learn that by asking the questions. And so, yes, the metrics are pointing to some really great outcomes thus far. But there's more that we want to collect to really inform us about how we can continue to improve our program. I'm going to sneak ahead here just to kind of show this slide that I was teasing a moment ago. So again, in terms of any programmatic change, this was our roadmap. This is kind of the compass that we followed. This was our North Star. So educating individuals, getting buy-in, articulating well the rationale and how services support your mission and vision, doing some continuous needs assessment within your community, what's there, what's not, acquiring resources and funding, like we said, over time. We've really done a phased approach, getting technical assistance, leaning on other experts, creating and leveraging those partnerships, as Mary Jo had referenced, either obtaining from others or creating your own policies and procedures. Of course, your team needs to feel adequately appraised and resourced, and then being okay with this not being the way that it is for forever, right? Being agile and being able to kind of retool and further support the community. The call to action is that if you're here, you are a belonging builder, you are a barrier breaker. It is on us as community members and service providers to assure that those who are under-resourced and under-supported in our communities not only have the things that they need to meet their basic needs, but really we are charged with assuring that they have access to the supportive services that help them to thrive in our community. And so very, very grateful to you for your partnership and for being here today. And we welcome you to outreach to us outside of this presentation so that we can continue the discussion on these important topics.
Thank you so much. I love it. And I hope to see more of this model across the country and everywhere.
Thank
Thanks
you.
so much, everyone, for joining.
If you find yourselves in San Diego, give Mary Jo and I an email. We'll chat on this topic further. Thanks to all. It's been a pleasure.
Chasing